Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I really wanted to show off this case because we actually have quite a few patients in this situation, and this can be really insightful to be able to see somebody go start to finish and kind of talk about what the options are. So let me introduce you to Grayson, and Grayson is missing not his two front teeth, but the next two teeth, so the lateral incisors on top. So what you're seeing in Grayson's initial smiling photograph here is that he has his two front teeth, and then he's missing the next two teeth. The next two teeth that you see are his upper canine teeth, so those typically are the third teeth from the middle. And then behind those permanent canine teeth are actually his baby canine teeth, which are still present, although there's not a lot of root structure on them. And then everything's kind of normal behind that. So that gives you a little orientation about what you're looking at. Grayson was looking for a nicer smile, and so let me show you a few other things. This image gets a little blurry, but just again, the two front teeth exist, the next two teeth are missing, the next two teeth are the permanent canines, so usually in the third position, and then we have the baby canine teeth in those third positions here, and so we talked about a treatment plan where we could close spaces and pretend like Grayson wasn't missing any teeth. There is an alternative form of treatment where you can remove the baby canine teeth, push the permanent canine teeth back to where they are sitting, and then make space where the two teeth are missing and then replace the missing teeth. However, the downsides to replacing missing teeth are, you've got artificial teeth in there for the rest of your life, and those artificial teeth can break. They can become infected. There's all kinds of problems that can happen with them. They might need to be replaced at some point over time. And so if you can work with what you got and close up the spaces and make it look good, you actually have just a natural dentition for the rest of the life, which is cheaper in the long run. And I would argue that you can get a really nice aesthetic result. So let me show you what we did. First of all, I want to orient you just a little bit about what's happening in the back of the mouth. So once again, this tooth right here is the baby canine tooth, and my proposal was that we were going to remove the baby canine tooth and close up spaces. And just so that you know, and to reiterate this, keeping the baby canine tooth is really not a great long-term option because the root structure on these baby canine teeth were already suffering and small, and there just wasn't a good likelihood that Grayson was going to keep that tooth into adulthood. So you really kind of have to commit to either taking out the baby canine tooth and pulling the upper canines back into that space and then replacing the missing tooth, or taking it out and closing up space as normal. So again, the red X illustrates the baby canine tooth, which is going to come out. And in a normal bite, this is how things should fit together. So if you look at these blue lines on the upper teeth, they should kind of move backwards to line up with these blue lines on the lower teeth. And that's how things should fit together if you are going to replace the missing upper teeth, okay? But there's an alternative that you could take the upper teeth and move them forward, and if they can line up with these black lines on the bottom, then you've got still a really good fitting bite, and you're moving all the upper teeth forward, a whole tooth forward of where they really should be, and that's how you can account for the missing upper teeth. So that's what we did. And just to illustrate, this is kind of a in progress where things lined up. And so we moved the upper teeth forward. So this tooth is now sitting right here. This is normally on the top where the upper canine tooth would sit. But again, we moved everything a whole tooth further forward to try to close up the extra space in the front. But you can see that we have this nice zigzag bite, which is exactly what we want. So we have a nice fitting bite in the back, albeit it's not what a dental textbook says it should fit like, but it's a great fitting bite and it's very functional for him. We've managed to close up all the spaces on top, and the canine teeth are now sitting in the second positions. So here's that progress again. We've got the two front teeth, then the next two teeth are his permanent canine teeth, and then the baby teeth have been extracted, so it's all permanent teeth as you go back here. Now what I want to draw your attention to is that these permanent canine teeth are a little bit pointy, not the most pointy canine teeth in the world, but at this point I wanted to start reshaping those canine teeth to look a little bit more like a lateral incisor would look. So if you notice kind of how they come to a point, and then I'll show you where we ended here. We kind of smoothed off some of those points, and we flattened the tooth out a little bit to make it look a little bit more like a lateral incisor. Now, a lateral incisor would not have this much space kind of right here between the tooth and the central incisor. So that's one place where I talked to the family about, hey, do we want to add some filling material in here? And they said, you know what, no, we're happy with the way that it looks. We like the idea of having just a natural dentition with no fillings, no artificial teeth, because those are things that just have to be maintained in the future. And so I can't argue with that, because when you look at Grayson here, this is just after getting the braces off. I mean, a layperson would be hard pressed to know that he's missing 2 teeth. I think dentists would notice, and orthodontists would certainly notice, because the shape of the teeth is a little bit different than the normal. But I don't think anybody walking around, just normal human beings, notice that Grayson is missing his lateral incisors. This is a beautiful result, great looking smile, good looking dude. So we're really happy with this result. Just to show you a little side-by-side of where we started and where we finished. Obviously, Grayson grew up a lot. This treatment didn't even take all that long, 2 years, maybe a little less than 2 years, but Grayson just grew up a ton in that time frame. Big credit to Grayson. He was an amazing rubber band wearer. We asked him to wear rubber bands to help do that bite shift in the back like I talked about, and to try to close up the spaces in a good, productive way. So here's a little close-up of what happened with the teeth. One of the other big things that we were working on was something called a deep bite, where the upper front teeth are overlapping the lower front teeth excessively. When this happens, lower front teeth and upper front teeth, for that matter too, are really susceptible to being worn down and broken down and chipped, because they're taking too much bite forces. And so you can see that we can see a lot more of the lower front teeth here at the finish. And this is just a really awesome result. Of course, the happiest guy when all this was over was Grayson. And, Grayson, we're really proud of you for being an amazing patient. I'm so thrilled with this smile. And, hopefully we can use your case to help guide other people into making great decisions about what to do for their orthodontic treatment. So thanks, Grayson, for being an awesome patient. And if you or somebody that you love is missing front teeth, let's get them in early. It's always great to have these things planned out early. There are some things that we can do to set up for success. And so it's always great to have a good plan in place for what to do about missing teeth. Thanks so much for listening.